Bismillahirrahmanirrahim. Assalamu alaikum. This brings us to the fourth episode of my journey throughout the knee surgery, and today's episode is also about the surgery itself. Once it was decided that I had to go through arthroscopy and might be able to go through repair of the meniscal tear. Uh, we had to choose from a few of the options from Lahore as well as in Multan. Some of the orthopedic surgeons are also performing this procedure in Multan, uh, and I was all for it, but somehow my family pushed me into opting for the option of Lahore, and that to Gurki Hospital. Uh, they were of the opinion that due to the number of cases, the expertise might be a bit better, even though trainees of Gurki Hospital are now consultants and practicing in Multan, and I know some of them, and they are very uh, competent and very helpful. They had been very important for me throughout my decision-making process. Uh, Ultimately, I had to go to Gurki Hospital, but I was surprised to see the patient influx there. It is just like a government hospital. The patient load is so high, so we had to go for executive package of the procedure. Uh, I was taken there, admitted, and it is a procedure of 1 day. मतलब we have to go through the procedure of roughly 1 hour, and after that they discharge the patient the very next day. Fortunately, uh, all of this was already arranged, and when I was admitted within 2 hours, I was called for the operation theater. And when I was taken to the operation theater, that was a very, uh, strange feeling. I mean, you actually, when you go through that feeling, you realize what our patients must be going through when we go through something big like a surgery. Uh, I already knew what I was going to uh, get for anesthesia. Uh, I chose the spinal anesthesia. Well, spinal anesthesia is in which they apply anesthesia via your spinal cord. They puncture it. Uh, uh, it is called lumbar puncture, and they inject it into the subarachnoid space. The other one is general anesthesia, in which they put you to sleep, and then take the whole control. Even your respiration is compromised, and you are put on ventilator. Well, this is a very uh, because I have also worked in anesthesia, so mm, I thought, what if I do not return from that anesthesia? Even the lumbar spinal anesthesia has its own, possible complications. But this for me, has been uh, very difficult thing to adopt to or accept. Okay, I have to go through general anesthesia, so I told the anesthetist at the start of the procedure, please, I will go for spinal anesthesia only, and it would be better if you don't put me to sleep during the procedure. So thankfully, they respected my decision, and spinal was given, and it was a totally different feeling. I have in my house job in anesthesia uh, given spinal anesthesia to multiple patients, but when you actually go through that process, the tingling sensation, you suddenly you feel like your legs and feet are burning. You feel it heating up, and the anesthetist is guiding you throughout the procedure and asking questions. Okay, now please tell me what you are going through, whether you are feeling this, whether you are feeling that, and you sort of feel confident. Okay, okay, these guys know what they are doing, and other patients go through this as thing all the time. So these questions are very reassuring throughout the procedure. Then came the surgery, and after they approached the intraarticular space, then even I could see on the screen that they were looking at a meniscus which was completely torn, and they had to repair it. Uh, and I was looking at it. It was not very, I was comfortable throughout the procedure, and I was rather involved in seeing my own procedure on the LCD. But after that, when I was brought to the recovery, I had to wait, before I could see anyone of my family or any. Uh, that was a time I think I had to wait like 40 minutes or 1 hour. So it was very difficult to, you know, pass. I did not feel any pain. Okay. Uh, it was totally painless because I had the effect of the anesthesia. Uh, when I go through the procedure and was shifted to the room, there were two things which were very, very, uh, hard for me. One was there was a nauseating feeling, and I even I think vomited twice. And secondly, uh, after 6 hours or 8 hours, when the uh, effect of spinal anesthesia wore out, then I was in pain. With even an inch of movement in a specific direction, at my knee, used to call the nursing staff for a painkiller. So it was, but it was covered by the painkiller. If not first one, the second one really covered it very well. Next step was moving back from. I was discharged the very next day, but the moving from Lahore to Multan without, moving the limb, it was very hard. For post-op and rehab, I, uh, I'm going to tell my story in the upcoming videos. The video is already I think 8 minutes long. So thanks for bearing with me. Uh, it was very discomforting, the nausea, and even I felt some palpitations at night. Uh, During my first 6 to 8 hours, I was NPO. I was not allowed to take any feed by mouth. So, but it got well when I took my first meal after the anesthesia wore out. So it was very good, and thankfully it was over. Or if any of you if any of you has gone through something like this, a procedure, one thing I have to salute all the ladies who go through C-sections and all this procedure, especially spinal anesthesia initially or GA, and later on the C-section. eh, Really, they go through a lot during this whole procedure. So even though it is a small procedure and very common, but surgery is a surgery, you know.